What's the process of
Hemato.
Liver?
creating blood cells?
Hema.
Blood?
Production of blood cells. Yep. To form blood cells. So if we take that word apart and we see heme or hema, even if we didn't know what that word meant, we could probably guess it had something to do with blood. Exactly. What's the shaft of a long bone called?
Diaphysis?
The diaphysis. Yeah, what are the ends of the bone called?
The epiphysis.
Epiphysis. And that nasty shiny lining around the bone?
Parents.
Peritoneum is in the belly. Periosteum? I'm just asking different things. Cells that kill bone are called osteoclasts. What about the opposite?
Osteoblast.
And what do they do?
Rebuild.
Build, blast, build, class, kill. Make sense?
Mm-hmm.
Okay. What joint am I working right now? I'm going around and around and around and around. I have one in my shoulder and I have one in my hip. Right. So does that provide a big range of motion?
Yes.
Sure does. What's an intercalated disc?
Something that's coming out?
Huh?
It's coming out?
Intercalated. Intercal. Yes, it's in your heart. Exactly.
It's in
It's in your heart.
Oh, intercalated.
Intercalated discs. They're in your heart. What specifically? Yes, exactly. Cardiac
What
muscle.
did you say?
Huh?
intercalated disc.
So would you, if you were to look at that, would you think that was striated?
Intercalated.
It would look striated, right? Because
Like
it's got
striped?
discs in there. What else looks striated?
Skeletal muscle.
Skeletal muscle. Why?
Because of the fibers, the muscle.
Because it has those lines in it, right?
Mm-hmm.
The lines. So that looks striated too. What am I doing here?
Flex,
Yes. What am I doing now?
extension.
Are these the same?
No.
Is it what?
Opposite of each
What
other.
is it? What would happen if I had an increase of growth hormone? Gigantism. Okay. What would happen if I didn't have a whole ton of growth hormone?
Dwarfism.
What does the hypothalamus do?
Produce hormones.
The one that regulate heat and body temperature and
Hold on. Page.
Regulate body temperature, keep the body in normal state.
Hold on. Don't worry about that. What happens if we have not enough iodine in our diet?
Goiter.
Yeah, remember I told you the story about the goiter belt? And what'd they do to fix it? What'd they do? They what? So if you don't have enough iodine, you're going to have a goiter. And we talked about the goiter belt. So what was done to stop the goiters? They had to provide iodine Salt,
Oh,
iodized
iodinized.
salt, remember? Does anybody remember this story? So if we take material from the kidneys and pull it back in the blood, what are we doing?
Reabsorption.
We're reabsorbing, right? If we add it from the kidney to the urine, we are doing what?
Elimination. Elimination.
Close.
Filtering.
Filtering is, no.
What's the other word?
You said if we take it
There's
from where?
reabsorption.
If we're
there's
taking it out of the
filtration.
kidney into the urine, we're gonna get rid of it. We're going to
No, it's not elimination. Oh my god.
secretion.
Yes. See? It's right there.
If you, I can't hear you guys if you don't holler it out.
No, I said.
What chapter was that? Chapter 12 was renal, right? So, going to chapter 12,
That's endocrine.
no, I want renal. 12 is endocrine.
Mm-hmm.
Oh, 20.
Okay, so. Darn it. For filtration, reabsorption, and secretion.
What about secretion, the second you said?
Secretion is when you
Kidney to-
pass it out.
From kidney to urine.
Give me some names when we pee.
Elimination.
Voiding.
Voiding.
What's that?
Micturition.
Micturition, urination. All three words mean the exact same thing, and yet we all still say, did you pee? Right? If I don't produce any urine, what's that called?
And
Huh? So the kidneys do not produce urine. Suppression, who said suppression? Suppression, urine suppression, okay? Which I don't think makes sense. I don't even like that word. I don't like it. What is enuresis?
No, you're not.
Involuntary voiding.
So, what's that?
Involuntary voiding.
Involuntary voiding. So nocturnal enuresis means you nocturnal, and that's called bedwetting, right? Now, if I had to put a catheter in somebody, what would I be treating?
Urine retention.
Retention. So what's the difference? Urinary suppression means there's none being made, right? So that patient would probably be on, anyone, huh? Dialysis, right? If the kidneys no longer produce urine. So when you have a dialysis patient, you have hemodialysis patients. Do hemodialysis patients produce urine? A lot of them don't pee at all. At all. Okay? So, if you were my student, which happened, and she went into a room and at 3 o'clock said, I forgot to ask, did you pee today? And he said, no. And she said, you've been here, I've been here 8 hours and you haven't peed. He's like, I don't pee. She's like, ever? He said, no. He's a dialysis patient. When you have a dialysis patient, you need to ask them, do you make urine? A lot of them don't. So when they go through dialysis, we weigh them before and after, right? And we usually have a big weight loss, and that weight loss could be considered urine. waste products, right? So if the kidneys produce urine and the bladder can't empty it, what's that called? Retention, yep. What could obstruct the urinary system?
Stone.
A stone, yes. A little too, I don't know, it's a little too early for this for me to talk about, but what is pyelonephritis?
Kidney infection?
Yes, also a little tender for me to talk about. What is cystitis?
Or urinary tract infection?
Huh?
Urinary tract infection?
Specifically the bladder.
Oh, the bladder.
Specifically the bladder, yep. So if we were to do a cystoscopy, we would be looking at the bladder, right. You have a lot of different tissue in your body, right? What contains the most amount of water?
You said contain the most?
Most.
Oh, interstitial.
You have body tissues. Name off some body tissues. Adipose. Yep. What else?
Yeah.
Water.
No, I'm asking you to name body tissues.
Oh,
Tell me the names of body tissues. Adipose is one. Is bone a tissue?
yes,
Yes, it is. Is muscle a tissue?
yes.
Yes, it is. Which has the most amount of water? Most amount of water.
Muscle.
Muscle. What has the least amount of water?
Adipose.
Adipose. Yep. So, what does aldosterone do? It helps reabsorb what?
Salt.
Sodium. And where sodium goes,
Waterfall.
water follows. So if you're reabsorbing sodium, you're also going to reabsorb
Salt. Water.
water. Exactly. So what's a sign of dehydration? Where that
Skin
relates to
turn.
the skin.
The skin tone.
Right, so I just want to show you something. So if I pull up and I let it go, what's depressing as hell is that, like, I'm not at all dehydrated and it still stays all pinched up. So I don't often think that's a reliable sign, but they will say that if you pinch your skin up and it loses its elasticity, that it's a sign of dehydration. It is also a sign of, see y'all smart, you're not gonna say it except for her.
Aging.
Old age, yeah. Old age, way to go. What's low potassium called?
Hyperkalemia. Is it
Hypo-
kalemia?
Low is hypo,
Hypokalemia.
and potassium is
Kalemia.
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 Okay, so how to remember that? Hypokalemia
K
is low
Yeah, potassium on the
potassium,
periodic table. I said that's, isn't that what potassium is on the periodic table?
K.
K.
That's
yeah.
exactly what it is on the periodic table, is K. So, if I had a high potassium level, you would say I was
Hyper.
hyperkalemic, exactly. But if I didn't have enough sodium, then you would call me Marisol.
Hyponatremia.
I didn't have enough
Oh,
sodium.
no, not calcium,
Natremia.
hyponatremia,
Hyponatremia.
you know what I said before.
Yes, hyponatremia. But if my salt level was high, which it normally is, I would be
Hyper.
hyper what?
Natremic.
Natremic, exactly. H2CO3 equals, what's that called?
Oh, that's
Chloride.
sodium.
It is respiratory, huh?
Sodium bicarbonate.
It is not sodium
Carbonic
bicarbonate.
Acid.
Carbonic acid.
Carbonic acid. Now, let me ask you a question. Hold on, don't get ahead of me. So, you are absolutely right in saying sodium bicarb, right? Because I mean, I shouldn't say you're right. That gets confused a lot. This is sodium, but sodium is Na, right? Okay, so don't confuse sodium bicarb and, what's this? Carbonic acid. Okay, so if I know that H2CO3 is carbonic acid, okay, what system does this work through? It works through your respiratory system, okay? So if anything, when we're talking about acid-base balance, if anything is up with my H2CO3s, I know it's going to be what in origin? Respiratory in origin, right? So what happens if I have too much carbonic acid? Respiratory acidosis, right? So too much H2CO3 equals, it has to be respiratory, and I have too much acid, so I'm acidic. Exactly. Now, if I have a decreased acid, then I'm going to have a
Alkalosis.
Okay, give me an example of what someone does to become a respiratory alkalosis. We give them a bag to put over their face. Well, we don't really do that. Hyperventilation, right? If I'm breathing really fast, I'm blowing off acid, right? So if I'm blowing off acid, I'm gonna become alkalotic, right? So, too much H2CO3, which is also known as carbonic acid. So if I have too much carbonic acid, then I'm going to have a respiratory
You said too much?
acidosis. If I have too much, if I have an elevation or an excess of carbonic acid, I'm going to have a respiratory acidosis, right? In the body. Everywhere, right? All over the place. Okay. Are they all glands?
Yeah.
Endocrine gland. I mean, they go hand in hand, right? Where do endocrine glands secrete their stuff? Into what? Yeah, exactly. And that's called what? Around the cells or intercellular, right? Okay. Do endocrine glands produce hormones?
Yeah.
That's pretty much what they do, right? It's produce hormones. And what's the difference in the endocrine system and the nervous system? They're both communications, correct? But what's different about them? One is slower than the other. Which one would be faster? The nervous system, exactly. Okay. Perfect. So, for pharmacology, so that's your review, guys.
For A&P.
for your midterm. Yes.
50 or 100 questions.
You have 50 questions, 5 math, 5 select all that applies. Okay? Omari, let me see your outline again. And this is a nice time to recenter ourselves and to get a nice grade book on page 415. You can write this down. You will see information about osteoporosis. Specifically, risk factors of osteoporosis would lend itself well to a select all that apply question on page 415 of your MedSurg ATI book. I don't know how I could drop any bigger of a hint than that.
That's one. We have 5.
I don't have to give you any, you know.
I know. We really appreciate it.
She's our class advocate.
That is, thank you. We had to talk about fluid volume deficits, right? We talk about fluid balance, right? And you would see something regarding on page 241, causes of excess fluid, or would that be called? Hypervolemia, right? Elevated fluid, elevated volume, right? Hypervolemia, and it talks about risk factors. So the risk factors on page 241 of you know what I mean. Makes a good select all that apply question. And in your ATI MedSurg book, on page 254, there's a little blurb about metabolic acidosis and what it results from. You might want to know what causes metabolic acidosis. Okay? That's 5. Oh my God, I'm so sorry. I'm so sorry. You're coming in a second. I could talk to you tomorrow. I'm so sorry. I completely forgot I had to teach. Well, I didn't forget I had to teach, but you know what I'm saying. I'm so sorry.
No problem.
I'll talk to you tomorrow. I apologize.
That's okay.
All right. Thank you, Omari. This is for you. There you go. All righty, on to farm. Okay?